Hi, everybody. We're just getting everybody on the line. So while we're doing that, I'm going to tend to a very diva dog who's decided to be very vocal and might be a part of our presentation today. So I'll be right back and we'll get started. I think we have about 70 people registered. Hopefully we'll get to that golden 40 and we'll go from there. So I think we'll get started. Elsa, do you want to share with everybody any technical information about today's presentation, and we'll get started?
Sure. Thank you, Andy, and welcome everyone to today's presentation on patient navigation and community health work in Colorado, the status and where we're going. Just a few technical pieces about Zoom, although I think people are mostly familiar right now. You're all on mute right now, but once we get to the discussion piece, you can unmute and ask questions, and we encourage you to use the chat as you think of questions throughout the presentation. And you can message me if you're having any technical difficulties. So we're so happy to have you all here. Thank you.
Awesome, thanks. And everybody, if you're joining today, obviously you are, if you can go ahead and write your name, which institution you're from, and anything you want to share about your role, that would be fantastic. And I just want to give a huge shout out to those who are attending from the Colorado, basically the Colorectal Cancer Control Program in Colorado. And many of you are funded by that grant with support from the CDPHE team and the Centers for Disease Control. So today is offered as part of that grant and resources from that grant. And I'm really excited to share a little bit about patient navigation in Colorado, also the examination of community health work, and also Promotor de Salud, and thinking about the directions in Colorado. Elsa Weltzing is actually going to spend a little bit of time also sharing a little bit about some of the work we've done with navigation sustainability in Colorado based on colorectal cancer as well. So unfortunately, I didn't add her name to the slide, but Elsa, a million thanks. I'm presenting on behalf of the Patient Navigator Training Collaborative in combination with a Trailhead Institute and the work that we're doing with CDPHE. So again, I think Ian, Nikki, you might be on the line. I'll give you a chance maybe to come off mute if there's anything you want to share. Otherwise, we'll start jamming on today's presentation. And again, I think we're just getting some of you joining in. If you can add your name, institution, what city, state you're from, and then a little bit about your role, that would be fantastic for purposes of today. We will be using the chat feature for Q&A. So Elsa will be helping me facilitate that discussion as well. We'll try to maybe take some real time, but we'll save some work until the end. Ian, Nikki, anything you want to share today? And I don't know if they're able to join yet. So, okay, just a little advance notice. I do have a pretty bad cold, so I'm going to try to make sure that I don't have any coughing attacks today, but I know we're all in it to win it and in this together in terms of the pandemic and everything we're experiencing. So with that, I just want to say a huge thank you for those of you who are joining today and spending that time with us. I'm going to go ahead and get started. Today, we're going to be talking about specifically what is part of the work that's happening at the national level and at the state level in terms of thinking about where we're going and supporting of patient navigation, community health work, how we're thinking about sustaining that from workforce development, training opportunities, initiatives that you all can engage in terms of providing workforce development opportunities, some of the wins, some of the areas where we need some additional work, and then about sharing a good bit about what we think in terms of opportunities moving ahead. And part of that's also going to be giving a glimpse at what's happening at the national level in terms of helping frame out our work and thinking about directions in Colorado. And you'll notice ultimately at the end, I have a join in the fun. Elsa is going to be putting together and distributing a resource information sheet. So today we'll be talking about broad strokes about what's going on, what's happening, how it all synergistically helps us think about where we're moving to really help this CHWPN workforce sustain in our state. But there's really a lot of levels that if you're directly navigating, if you're managing, if you're interested in having the conversation and being around the table, there's a lot of ways to engage. So I'm going to touch around those and about those today, share some great evidence, some background, but there's also a real opportunity for all of you to really join in those resources that are available in our state, which is great because Colorado, we truly are bountiful in terms of the support and opportunities for CHW and PN work. So I'm going to start by today in terms of sharing a little bit about what we know and what's been accomplished nationally, some of the historic framework, and I'd like to do a little bit of an overlay of really what's happening in Colorado. So if we really think globally about the navigation and community health work movement, really back as far as the early 70s, specifically for cancer, we saw a lot of momentum around the National Cancer Act. Even with Nixon declaring the war on cancer, we started to get some great momentum over the next 10, 15, 20 years, where we started to really think about health disparities. And one of the first reports to the nation on cancer in the poor is when we really started to talk about health equity and access. And I think it's one of the times in history we started to see people of color. We saw medically underrepresented communities around the table to talk about the opportunities and the direction. So many of you know Harold Freeman. We know even in our own state, Linda Burhan-Stepanoff. We're really very much involved in that establishment and the navigation movement. But the CHW Promotora movement is widely employed and through FQs and migrant and CBO works in Colorado, even well before this time frame. I think we had a lot of people who were doing this sort of community engaged work, and although they might not have called themselves community health workers or navigators, we know there was a lot of engagement about barrier reduction and access to care. But really in terms of formalizing this work, Dr. Harold Freeman, through the American Cancer Society and part of the President's Cancer Council, really started to establish this work and really talking about the report out of what he was seeing around late stage breast cancer diagnosis in Harlem. Linda Burhan-Stepanoff and the American Native and Indigenous communities. But even as we started to move that ball forward, it started to talk about the professionalization and really recognizing community health workers and patient navigators and really showing that impact in that research. So, that really marches us on to the 2000s. Even when in Colorado, we started to see development of funding from the NCI, where we're looking at outcomes, where Denver Health University and a number of groups are really engaged in showing those health outcomes and developing that navigation role and ultimately showing the opportunity. So there was funding and continued funding of this work, showing that evidence as a promising practice and then developing as an evidence-based intervention. So what's great, I think that Denver Health created a community health worker certificate with the community college system even well before the 2000s. We're starting to do stronger research and then ultimately started to see stronger definition of navigation, particularly in community health work, and started to do more established training and then really including NCI community cancer centers really starting to establish that role. So this is great because I think what we can see is there started to be movement because we're starting to see that professional development. But a lot of this work really did stem out of Colorado, and we're really proud of that. I think as we started to march through the 2000s, of course, the Association of Community Health Centers, a number of the professional organizations, including nursing associations, really tried to think about that distinction of CHW and PN work, where acuity was needed for special types of navigation, but really also considering that lay navigator role. And I think as we started to really move from 2010 and beyond, there's a lot of conversation in Colorado that really understanding that role of community health worker and navigator in the community, with the community, and that access and bridging to care was huge. So ultimately, we started a statewide alliance, which I'm going to talk about that. But at that same time, we started to see a Commission on Cancer and other accreditation groups really move towards really thinking about the implementation and really codifying that role with reimbursement measures. So we saw Center for Medicare and Innovation, oncology models, Oncology Nursing Society, and then even up until 2017, started to look at more evidence-based metrics. So what I'll say throughout this entire span is it's great. We started to really define the role. We started to think about that function and role of CHWs and PNs particularly. We started to do that research to show that. We see that uptake from some of the accreditation professional groups. We see models started coming forward. But even up until 2017, 5 years later in 2022, we don't necessarily have a standard way to bill and reimburse for patient navigation. So this is a great trajectory. We're making some good gains. Colorado, between the two sides, you can tell we're in it to win it. We have a lot going on, but there's still a lot of great work to do. So for today's purposes, I'm going to be really talking about not just health navigation, but also community health work, and then promotores de salud. And so I'm showing two distinct definitions based on what's established by our own state health department and the work that's been done, as well as the Centers for Disease Control. So community health worker, a lay member of the community who's trained to deliver an intervention from the community in a community setting. Most of the time, these are individuals who are from that community and are tightly knit to understand the resources and challenges that are happening within that community. Promotores de salud, which has a stronghold in Colorado, are lay health workers who work specifically in Spanish-speaking communities and really have very much a similar function to CHWs, but really work with the Hispanic Latino populations within our state. And then health navigator, as noted by CDPHE, is a trained member of the healthcare team, typically employed by health delivery systems to assist individuals in reduction of barriers, access to care, particularly in the healthcare settings, which are by design complex. So I just want to say that I think that there's some really great role distinction, but there's also some overlap between these positions where people sit in terms of their job and employment, who they interface with. But I think these definitions have been very helpful for us to think about the wide gamut of people who live and work with their community to deliver services, as well as those in the health systems, because ultimately we really need to nurture, maintain, and appropriately compensate all the people who fall under these definitions in some variation. So, I often get asked, and I think the question is, how many community health workers, navigators, promotores de salud do we have in Colorado? So this is something that we still are trying to capture, but I think one of the great indicators to show how robust the network is within Colorado is right now the patient navigator training program typically draws in 150 to 200 people per year. So we know that most of those largely are from Colorado. There's definitely a national number of folks that are trained, and there's a draw. But ultimately, if we take this, roughly 150 to 200 people at 200 to think about the number that are trained, this is a huge workforce within Colorado. So there's that lovely canine I was talking about. Let me see if I can just have her be quiet really quickly, or if my husband can help. And he looks like I'm coming in for reconnaissance. So in terms of really thinking about these specific roles, today I really want to talk about what we know has been super helpful within other states in terms of sustainability around CHW work, particularly Promotor de Salud, but I think a model we can really help to think about for navigation. And the reason that I bring this up is, sustainability, and I'll reiterate this, it's not only about paying for navigation, but if we don't really think about how we develop that workforce, maintain people in the profession, help support them through occupational association and standards, as well as that long-term financing, it's not going to stick. And I think that we have some examples of this all throughout the different types of supports and evidence-based interventions. But I'm going to talk about this today because I think it's really helpful for all of us to think about how we can engage. So I know a number of us are really involved in the cancer prevention world. Those of us who are working on the CRCCP, the Women's Wellness Connection, the CCSP program. So I'm really excited as we talk a little bit about this, also some of the standards and opportunities, particularly for prevention that fit. Because I think a lot of the work has been done to date in terms of care delivery for cancer prevention, but we also have some great opportunities throughout the care continuum. And ultimately, some of the strongest outcomes in terms of navigation have been in prevention and early detection. So what I want to say in terms of, kind of backing up, so thinking about that workforce, occupational standards, and that financing, we're going to kind of hit what's happening, what the state of the state is, where we are in Colorado, and again, some opportunities for you all to engage. So what I want to say is I think our state health department and CDPHE have done an amazing job in terms of setting up some opportunity to really think about a sustainable framework. So they've done a really nice job with their workforce development collaborative, really talking about sustainability. The state health department right now has, in the last 5 years, dedicated a lot of resources to really think about that definition of navigator within the system. And so currently thinking about targeted populations, the training programs, workforce competencies, employment, there's a wonderful rubric that's set up that I think helps really define part of the registry and the assessment process that they've developed to help really codify that navigator role and really develop that registry that exists right now to really think about solidifying the role of navigators. What I would say, and I think we're in constant conversations about, is where is that role of CHW and how does that fit within the framework that we've created for sustainability? And so I think, again, the health department through their grant program, CRCCP, the CCPD grants program have donated, not donated, but funded millions of dollars of this infrastructure work in Colorado in conjunction with their registry program right now. And I think that discussion around where do CDS, community health workers, fit is going to be a huge part of where we go in terms of this workforce development. So Elsa is going to send the resources around, but I do want to say, and I know a number of you have set for that training component, the registry assessment, and have been placed on that assessment as a workforce development opportunity through the state health department that exists. I have to say that I think a number of the domains largely fit both CHW's promotores de salud as well as community health workers. But I think the competencies that are trained upon and tested really need to be expanded and really thinking about the community function in this setting. And I would say even with the Patient Navigator Training Collaborative and the work we're doing, you'll notice Patient Navigator is the main heading in that PNTC acronym. And so I think even the discussions around training of patient navigators, community health workers, that needs to be expanded through our training delivery, as well as how we think about really codifying those roles and developing CHWs, PNs, and promotores de salud. So a huge shout out for all the great work. Ultimately, the training programs that are recognized to help with that navigator in system approach for people to be trained to sit for the assessment and ultimately through registry for the workforce development really include right now Boomers Leading Change, which I think might be transitioning. Otero Junior College was one of the groups as well, Patient Navigator Training Collaborative, as well as Metro State University. I think there's been a bit of changing with a number of these groups, but these are a few of the groups who are definitely established, have those training programs. And I think they're in contact constantly about meeting the training objectives for the assessment and then ultimately the registry component. But what I wanted to say is I think our state health department has granted a ton of money towards funding navigation, a lot of resources in workforce development, but we have also a number of training opportunities within Colorado for CHWs and navigators. And right now, even Community College of Denver and several other groups have had a standard history of developing community health worker trainings. But I also know that CPC in Colorado, Linda Burhan-Stipanoff with NACER, a number of other groups also have in program community health work and navigation training. And so I think this is a huge resource for us. So I just want to say, you know, in terms of really thinking about that role and distinction, in terms of having a workforce development, Colorado has a lot going on. And again, we'll share all the information about how you can really be involved. So again, I think our real call to action is we'd like to see, you know, that community-based function. We know that right now the competency assessment has a bit of a cost. It's oftentimes helped with employers. We know right now that there's a strong pass rate, but it's a really strong assessment in terms of making sure those rules around in-system navigation are met. It's based on scenario-based learning. And we know right now about 16 navigators per session based on what CDPHE is represented up until about a year or two ago, sit for this group. So again, I think that registry is really starting to develop. We have a number of you who've gone through that. And I think some of the great feedback we've received from people is that it really does help them feel a sense of accomplishment and really sort of knowing that they've gone through an assessment and validated their work as for that inpatient navigation. So we're expanding, we're excited about expanding really where this can go moving forward. But again, we really want to focus on health navigators as well as CHWs moving forward. So in terms of really kind of thinking about that workforce development, again, between the training programs, the assessment, even the funding, we're doing great in Colorado, as well as our national partners really helping fund the initiatives. So in terms of the occupational standards, you know, in terms of Colorado, one of those key objectives to sustainability was also looking at a statewide alliance or a network to help really think about helping support CHWs, PNs, and community health workers. So in about 2012, we did have that start of our statewide alliance. We are now a formal 501c3. We've had a little bit of ups and downs in terms of like creating a coalition and network, but we've received some grant funding. We're really expanding that opportunity for opportunities to engage with education, other network partners, but this really is a statewide alliance that seeks to help develop and support that workforce. So again, we are going to be continuing the discussions around helping really advocate for the role distinctions, but also for that reimbursement. But also this is a great opportunity for us to really gather and support community health workers and navigators for all facets of work. So many of you may be on the distribution list. If you're not, again, we'll give you an opportunity to really engage. But again, I think if we're thinking about what's been successful for states who really sustain community health work and patient navigation, really that statewide alliance and a network that really helps coordinate that workforce are key. And we have that in Colorado, and there's a number of great ways for you to engage. But I also think what's great is right now we have a number of national associations, such as the National Navigation Roundtable, as well as the National Association of Community Health Workers, who really also look at what are the federal and national opportunities and how they can best support states. So I can say that we do have a strong network within Colorado who are engaged in leadership in the NNRT, as well as NACHWA. We have a lot of interface in terms of thinking about that support. But we also have groups like the AONN, who you saw back in that history group, who really talks about that really thinking the supporting of cancer navigation. And our state cancer coalition has just started our patient navigation task force. So again, I really think that it's great to have a global community of CHW, PN, and an alliance and a network, but it's also great that we have some of these state-based organizations who are helping supplement, specifically in cancer, heart disease. But we also have this group nationally who are helping us think about where we're going with some of the federal opportunities and national opportunities as well. So I'm excited I get to be the chair of the NNRT this year. It's going to be a lot of good fun. But I think even with the experiences of COVID and others, we have a lot of work cut out for us, really thinking about how do we really help support this great work. But I'm excited to be able to carry this message from Colorado and what the needs are. So we've talked about the workforce development. We've talked about that occupational group and really supporting that group. But I think this is a part where things get a little tricky, and we'll talk about what this means for Colorado and what we're seeing in the nation. So the idea of sustainable funding. So here's where we know. And I think this is a fantastic map because the National Association of State Health Plans, I believe, or public health groups, has recently put out what is it that we know about reimbursability from Medicaid programs for at least community health work all throughout the nation. So if you notice the kind of pea green color, not so attractive, which I guess correlates to what it means. Currently, those are the states that don't reimburse for CHW services through their Medicaid programs. So if you look at that, that's about half the states. If you look at the darker green, Medicaid does not directly reimburse community health workers for their service, but they might through managed care operations reimburse for CHW work directly. So you'll notice we're one of those. So I know a number of our RICOs have been instrumental in helping use some of their Medicaid support dollars to fund community-based agencies and others to deploy really community health work navigation. So we do know there's some of that money that's being spent out through that mechanism. And then for the light blue, those are groups who are reimbursing for community health worker through Medicaid contracted services. So what I want to say is, if you look at this map 5 years ago, I would say about 70% of it was that pea color. We're starting to make some movement. And again, this is just really looking at Medicaid reimbursability. But I do think as we start to move forward, we might also look at what are the other payment mechanisms that can be essential outside of foundation and grant dollars. So kudos in Colorado. I do think through some of our managed care organizations and their foresight and their dedication to the programs and CHWs and navigators, we're definitely seeing that. And great work to a number of those agencies who've helped been really involved in that engagement. So good news for Colorado, we're about in the middle of the road, but I think we can really think about where we're moving next. So one of the things before we get into some of the next discussions around where we're moving in terms of Colorado, based on some of the current discussions around policy, some of the stakeholder engagement, I do think there's also some specific examples of what programs that are large in network and opportunity can share around the community health worker, patient navigation approaches around sustainability and how individually groups are making their case, but ultimately how this information can be fed, I think, into guiding us in terms of where we're going in Colorado, in terms of really thinking about opportunity for longer term funding, opportunity for sustaining, and then really that engagement and a stronger network to make sure community health workers, navigators, and promotores de salud are all seen as really viable parts of our health system, community engagement, who receive adequate and ample reimbursement for their time and services, and are seen as a dedicated part of the healthcare and community-based delivery team in terms of thinking about wellness and health. So I'd like to introduce Elsa Welpsing, who is a part of my team on another project at the university that's specifically dedicated to statewide approaches for cancer prevention navigation, and particularly really thinking about that cancer prevention navigation component. So Elsa, I will run the slides and I will kick it over to you to share how the CCSP program has been thinking about the sustainability, some of these components for really thinking about moving in direction towards sustainability, as I mentioned, even kind of based on those three components. And if you don't mind sharing a little bit about what we're learning at the individual clinic level, helping with the program, and then how you think it also really bubbles up to really defining where we're going as a state in Colorado, as a state in terms of thinking about really progressing community health work navigation and promotor de salud work. So I'll kick it over to you, Elsa.
Thanks, Andy. And so for those who aren't as familiar with the CCSP program, we partner with safety net clinics and hospital systems around Colorado to really support their patient navigators in helping deliver services to the medically underserved to help them get into cancer screening for that early detection and prevention of cancer. And so thinking about sustaining that role of navigation for cancer screening and beyond, as many of our patient navigators are also wearing many hats and helping navigate patients for a number of other disease areas and needs, we wanted to go through a dedicated process with each of the clinics participating in the program to understand what their strengths were and potential areas of opportunity to improve when they're thinking about sustaining that navigator role. So we worked closely with Washington University in St. Louis to adapt their sustainability planning process and tool, really looking at sustainability capacity from a holistic approach. And so thinking in a clinical setting, what the ability is of an organization or healthcare setting to maintain care practices over time, and what the needs are to adapt these practices in response to the changing landscape and new information. And so they have two sustainability planning tools, the program sustainability assessment tool and the clinical sustainability assessment tool. So working closely with them, we adapted a hybrid approach tool. That's the patient navigation sustainability assessment tool. And you can see those domains that examines on the right. I'd like to point out that funding stability is one of those key domains, and of course was a great interest to our clinic systems, as CCSP currently is funded through a competitive grant, but that it's really important to think about sustainability in many other areas, as they are all interconnected. And when there's strengths in several of those other areas, it can help make the case for funding stability from internal sources from an organization, as well as other supports beyond just that institution for what a healthcare institution feels like they can't cover for patient navigation. And so the general process that clinics went through is having a small team of individuals from different roles, including navigators, leadership, QI, and beyond, to each complete our short sustainability assessment, looking at each of these areas, and then we supported their teams with using those results as a jumping off point to develop a sustainability goal and plan around 1 to 2 of those domains, and providing technical assistance, connecting them with resources to really implement those plans, with a focus on that this is an iterative process and they might need to adjust and reassess as they go through the process, and seeing where those strengths and opportunities change over time. Next slide, please, Andy.
It didn't change yet, did it also?
No.
Let me see, here we go, here we go, let me see. Let me see if it's gonna, okay,
There
there
we go. So we had 17 clinic systems that were able to go through this assessment and process to develop a goal and plan. And some of the strengths that were across the board for our clinic systems were having strong engagement from their staff and leadership, and really that buy-in from leadership and staff that patient navigation is an important service and makes a difference in supporting patients with reducing barriers to getting screened for cancer. That organizational context and capacity that they're able to keep that navigation role going as the needs and even the people involved in the organization change, and that engaged community. So that includes both buy-in from patients that this is an important service, having patient navigation in CHWs, as well as buy-in from other organizations and programs that they work closely with, even in different departments within the wider health system. But some of the barriers that were identified, funding stability was identified as a big barrier for many of our clinic systems, but also that it was really important to be able to monitor and track the outcomes of navigation, and really having better communication and documentation of their process for implementation. So clinic systems involved in CCSP really felt like in the current time, the domains that they could address and really move the needle and improve in their sustainability plans were workflow integration, communication planning and implementation, some focusing on funding stability and making that business case, as well as looking at their processes for tracking and looking at those outcomes and effectiveness of navigation, and feeling that workflow integration and having training protocols and everything documented on paper was really important for making sure that navigator role is integrated within the full care team. And so from this, we've been able to really think about what CCSP as a program can support clinic systems with, what they're really able to focus on as an organization, but also seeing that there's additional work that really needs to be done to support clinics with reaching funding stability for navigation. Because as Andy has discussed in Colorado, there's some movement around supporting the navigator role, which has been really essential with that registry, as well as CHW reimbursement through Medicaid. But there's still a lot more that clinics feel like they need to really adequately be able to sustain the role for a long time, and needing to look internally as well as to lessons learned and the role of other organizations to move towards sustainability for navigation. But clinics did say that no matter what the case is for funding, they were going to make it work, but to be really successful, that funding stability piece would be important, and that all of the other areas were really helping them sustain that role during COVID and all of the changes that that brought.
Great. Elsa, let me ask you this. I think that it's great because each of these individual sites are really thinking about their roles and what's important to them and where they're going. If you had to say holistically, what we're learning about this to help think about the movement in Colorado, and what you would share from this experience to help drive that work, what would be the big take-home messages as you're thinking about that workforce development and sustainability?
I would say that from an individual clinic level, clinics really are going through a dedicated process to make sure that navigator role is understood by the whole system, what the value is, and really making sure they have access to data about how it's effective, but that clinic systems feel like that internally they can only do so much, and they really need additional support from coalitions and other groups that really are looking at navigation from a holistic sense of there's still that need for funding stability, but we can draw upon a lot of strengths from what clinics already have in place, and really having the navigator integrated in their workflows, in job descriptions, and valued by the whole system is really important as a first step, but that there's more that needs to be done to really make sure that funding stability piece can be there, because clinic systems are seeing that value add, and how the revenue from patients going through services can help support, but that they don't feel like on their own right now they have enough funding beyond just grant and foundational dollars to be able to keep the work going.
Good deal. Okay. And I think that this is also important because I think that each one of our programs, the work that we're doing, we can share those lessons learned, the results of the return on investment, the assessments you're doing. So utilizing, the Alliance, sharing information with program planners and CDPHE, what have you, will really help move and bubble up with that questions and what's the experience in the field. So what I would just encourage all of you is, again, today, coming out of this meeting, there will be an opportunity to engage with the occupational workforces, the alliances, the cancer coalitions, the National Navigation Roundtable, the NACHWA, Academy of Oncology Nursing Navigation Plus group. I mean, there's a lot of real great opportunities, but we really need folks from the field who are doing assessments, who have common issues or what have you, to really join us so that the collective voice can really be moved, because I think that's key also. Is not sometimes individual clinic systems or even types of individual organizations can't necessarily move in the way that we need for policy or for reimbursement, but their stories are critical, and experience and data is critical to move that forward. So I think that's a key message. So a quick note, and then Elsa, do you want to talk about this resource, which I know will be on the resource list, but it looks like this one's stuck into the slide deck. So you want to talk a little bit about where people can find the information and next steps moving forward?
Sure. So for that process I just talked about with what we did with CCSP, we have all of the resources of the ability to take that sustainability assessment, look at all of the domains, get templates for an action plan to develop a goal, and some of those key things to think about if an organization wanted to go through that own process to look at their internal capacity for sustainability. So all of that is available on our sustainability website.
Very good. And it'll be part of the resource list as well. And then I know we have a number of colorectal cancer screening program navigators. One of the other things I want to just reach in terms of really thinking about opportunities for really sustaining and paying for colorectal cancer screening navigation, and some of the fundamentals are noted today, is really embodied in a toolkit that we helped develop with the American Cancer Society National Colorectal Roundtable about 3 years ago. Needs a little bit of an update. But what I would say though, is if you're really interested in how do you help make that case, what does other states have done, what are those accreditation measures, how have people really looked at sustaining this work in their individual system, and how to really connect with opportunities, this is another resource that really exists. And I'm happy to say that my team in Colorado, as well as a national network, really put this together. So there's a lot of Colorado facing type opportunities in our experience here as well. So we'll make sure that that is part of the resource list as well. So what I'd like to do, and I know that we have a really strong showing today, almost 60 people, and I know a number of the CRCP and CPED program partners are there, which I'm super stoked about and very happy, because I don't think on some of the webinars, we're not quite sure who's showing up. But we also have a couple of national partners who I didn't realize were joining today, but I've mentioned them, I've talked about them, as well as some of our state partners. So at the end, I'm going to give a chance for them to come off mute. Monica and Sharon from AONN, I'd love to hear about how you're supporting the work in Colorado. Monica, our work in the prevention navigation sphere, and then Sharon and I have been talking about how AONN can help support lay navigation, nurse navigation, and really thinking about the sustainability work. So ladies, you're going to be put on the spot. And I believe Christy Cahill, I think, is on the line from our Statewide Cancer Coalition. And I'm not sure if any of the other task leads from the Navigator work group are on. But just a heads up, if I can have you guys come offline to share a little bit about some of those additional resources in Colorado, that would be fantastic. But what I'm going to talk a little bit about today is also where are we going? So, you know, we talked about, we have this statewide alliance. We have the workforce development and registry with a little tweaking is going to probably go the distance. So those are two of the big pillars. We've talked a little bit about where we are in Colorado. We're that dark green. So we're getting some Medicaid dollars. I saw a question come up. Do we know if there's private insurance plans that are reimbursing? The answer is largely no. I know that we've had some pilot from Blue Cross Blue Shield. I know that some of the other groups, even CMS has looked at pilot models for delivery of community health work and patient navigation mainly. And those are models. There's different things that they've piloted, but it hasn't necessarily meant a strong continual reimbursement in this fee-for-service model. So there might be another group or plan that I don't know about who's really working it through. But I would say, again, those managed care organizations who've done that sort of pass through with their Medicaid dollars, that's been a huge win. So I'm going to talk a little bit about some of the things that we know that are rocking in Colorado. So about 2-3 months ago, a number of us happened to be having conversations knowing that the legislative cycle was coming forward about how do we really talk about this role of really codifying PDS, CHW, PN in Colorado and making this movement. So I know within the university, I started talking to our leadership, our policy folks, but concurrently the Colorado Hospital, Children's Hospital had also started to have concurrent conversation, and under the direction and work that Ellen Stern is doing with the policy work, reached out to us at the School of Public Health Cancer Center and said, we're really interested in exploring this opportunity of coverage for community health work and, you know, kind of a movement towards navigation as well in terms of looking at opportunities. So we were really excited, but I can say, spoiler alert, is the legislative session is still in, it started, I think we're almost 3 weeks in. So unfortunately this year, there's not necessarily legislation that's going to come forward that specifically addresses CHWPN work and looking at reimbursement with Medicaid or other models, but we've had a number of stakeholder engagement conversations, and that ultimately I can say that based on this work group, that's kind of an ad hoc group that's developed, we do know based on our state agency outreach, there's really strong receptivity to explore mechanisms and existing vehicles for CHW patient navigation reimbursement. HCPF has reported, HCPF who manages Medicaid, reported on their work to advance the alternative payment models, also called APMs, as you might know them, and discussed avenues to include community health workers as part of this initiative, and discuss potential opportunities for replicating even some of the peer support legislation that's already been moved in Colorado. So those are some of the things that I think when we were really vetting this idea of reimbursement through Medicaid for community health workers, and I'm going to make an extension into navigation as well, strong receptivity, strong great work within the state. So I think we're all really there. The question is how to deliver it. So in terms of, as I said, spoiler alert, we're not putting legislation together at this time in terms of a standard standalone activity for reimbursement and thinking about CHW and PN work. There's two real strong initiatives that we are watching. And part of that is the health force workforce package that I think the Colorado Hospital Association is really driving. It's a broader coalition that really thinking about the cross-care training of healthcare staff, navigator trainings, thinking about the training of the field, where does it do in terms of really looking at complementing the current workforce in that coalition building. So we're having strong conversations with them at this time to say, what is it that we can do with their legislation to help really build out that opportunity for community health workers and navigators. And I also think there's legislation around behavioral health aides and really thinking about their behavioral health transformation task force and what they're doing to see if there's opportunities that will be allowed for someone who's serving as a community health worker and navigator as part of that work and delivery of health, behavioral health interventions. So again, these are strong conversations that are going to continue. We're going to watch where that legislation goes, see if there's a good fit. But I think one of the things that we've really chatted about is, even if we see advanced payment models and an opportunity, even if we some of these opportunities that we're talking about right now, we really need to codify that role of community health worker and navigator within that system. So again, we're not really sort of blanketing, and they don't necessarily have a place, or people who are utilizing reimbursement methods don't necessarily see CHWs or PN as part of the healthcare delivery team. So we still have some work, I think, to this next year to really codify those roles. And those are going to be some continued discussions. So right now, we're taking a little bit of a pause. We were hurrying right up till the legislative session started, thinking we might be ready to do something. But I think it's clear from the community health worker, navigator, PDS community that we still have some work to do. So there's going to be a pause in the current stakeholdering, which I've turned into a verb. And we're going to get some insight from partners, as well as what's happening throughout the country, to get a sense of where we go. Seeing how those two bills progress, I think, is something that those policy teams are going to work and then really help engage some conversation. And then in terms of this engagement of this coalition, I think that will be probably something will happen in spring or late spring, early summer of next year, of this year, so 2022. But if you're interested in engagement, again, the resource sheet that we're going to be sending today will talk about how to engage in this work and discussion. But in terms of thinking about, ultimately where we are with this and work and where we're coming in Colorado is, I think the Medicaid payment, even the private insurance, those still really dead in within a health system region or type construct. So hospitals, clinics, even behavioral health centers, those are great. And that's great if we can get that reimbursement. But I think there's a strong cry for the community, and I completely echo, is what about the community health workers, promoters particularly, who work in the community with the community? Again, that dark green, we're finding some ways to shunt that money out. But I think ultimately, how do we really work to make sure that those payments come direct, so that way we can really talk about that as a sustainable funding mechanism moving forward? I know I've talked a lot about Medicaid today, but I do think, as noted in the chat, ultimately private insurance, some of the other models for payment. And I think that's one of the things that's coming up. We're very much still in a fee for service type of environment, but bundled care, quality payment, bundled payment, that's something that we're striving for, but we're still sort of in this thing where we're really trying to achieve that type of model of reimbursement where CHWs and PNs, if we distinctly talk about that role, may fit, but we're still in a very fee for service type environment. So how are we going to reconcile that with in-system, through hospitals and clinics? And then how do we think about that outside in the community? And then what do we do with that payment strategy? So $1 million to anybody who can figure out that by the end of the call. I don't have $1 million, but just in case you do, we can find it. So, and then I think that what's to be determined as well is I do think a lot of the state agencies, a number of the foundations, are really considering what are their funding strategies around direct support and navigation community health work. And I think we're all really excited about this idea of common and strong reimbursement methods. We're just not quite there yet. And so I think that I'm really anxious for that. I think that we can't always live off of grant and foundation funding, but we're also, kind of also another place that we're stuck is we haven't quite achieved that reimbursability for our navigators, community health workers right now. So what I want to say is, again, I've been talking a lot about the money component, but I think as Elsa mentioned, really, if we're going to make sort of a sustainable framework and rubric for moving our work ahead, it's all of you sharing those cases, the delivery, what you're learning in terms of navigation, helping support that workforce delivery and tell those specifics to make the movement really happen within our state. We will be sending out a resource list in terms of how to engage, where we're going, being a part of these conversations. But I would say, again, if you're a navigator who's just new to this work, learning about the state health assessment and registry, joining in with the trainings that are allowed through Patient Navigator Training Collaborative, our AONN partners, learning about our statewide alliance, as well as our state cancer coalition. There's a lot of amazing ways for you to engage. So, I tried to give an overview of where we are in terms of the state, but I also really want to mention that there's a lot of ways for all of us to grow the network and where we're going. So I'm going to stop talking, and I would see if Sharon and Gentry is really Sharon and Monica, if you guys can get on and say a few words about the work that AON is doing. We're going to have your work as part of our resource group, but I'd love to hear about the work you're doing in the commitment to Colorado.
Sharon, do you want to start or do you want me to jump in?
Sure, the $1 million question, Monica. Thank you. And great, great information, Andy. And I'm excited to see everyone here from Colorado. You know, Andy, you've got a voice through the whole navigation network by just being a local navigation network here in Colorado.
Mm-hmm.
So you're collectively, the professional organization listens to your voice and what you have to say. I think that one of the barriers that we're going to be facing as we go forward with sustainability, I'm not sure that we can lump all of the community health workers, all the patient navigators, and all the nurse navigators in one category. I think that the community health workers have a head start on us because some of them are reimbursed by the state. And the reason I say that is because sometimes they have a bigger focus than oncology. So they can engulf a lot of things like cardiac, diabetes, other things of that nature, where we're just a little bit more limited focus. Not to say that community health workers that focus on oncology could not come under the patient navigation definition. Absolutely, they can. So when I think about sustainability, you're working on this. AON Plus has a vision for sustainability and get reimbursement back. The National Navigation Roundtable is working on that also. And the nation, I think it's the National Patient Advocacy Foundation, is taking it from a social needs perspective, that they're trying to work on that together too. So I know everybody's going to hate it when I say this word, but it's all about metrics. And it's all about how we measure it. And you've got some great, because I listened to your other sustainability presentations, you've got some great metrics that you've gathered there, but that's how we're going to have to present our value. I'm not sure that we're going to make it under the fee for service, and I'm not even sure the fee for service is going to make it. But when that big bucket of money is given out for a certain diagnosis, navigation can step up and say, we can make a difference. We can make a difference on the resources they use. We can make sure they get through the system appropriately. We can find them resources that they have that we can use to support them. So as far as that being said, as far as what we can do, we need your voice. We need your voice here at AON Plus through your Colorado local navigation network. What are you seeing out in the community? What are you experiencing? Plus, sometimes people come to us and they want to use your voice on projects, and we have access to you. That helps us collectively gather your voice and put it forward.
Great. And then Sharon, AON in terms of the workforce development and that training, that's a resource that does exist to you. Or Monica, want to just say a few words about that?
But I'm sorry, the training for
the work that you guys do around training and kind of the quasi, not credentialed, but in terms of people really looking at navigation professional development. Do you want to share?
Absolutely. Absolutely. We have, if you go on our website, we can take you from A to Z as far as training. We can take you from the basics of navigation all the way through how do you do metrics all the way. We absolutely can do that. And that's interesting because we're getting ready to look at absolutely redoing our basic training again, because COVID changed us. We've got to talk more about digital means and everything. And so we've got a lot of updates to do, but the basic training is there with examples and case studies there on the website. I always tell people, don't reinvent the wheel. Look at what we have and try to just work from a little bit at a time to go forward.
Right. So I think this is awesome. And Monica, anything else to add? It's awesome, ladies. I didn't expect you to be here, but I'm like, oh, look, they're here. Yay, Monica.
No, absolutely. I mean, I think the work that's happening in Colorado is just tremendous. I think you guys really have set, really the standard across the states. And really, I think people can model after the work that you all are doing for patient navigators and CHW. So applaud to you. And of course, with the training collaborative, it just provides so much support. So, AON is here to support you in any way, shape, or form. And obviously, we also, when people come to ask us, what other resources are out there, and, we forward them your way. So, and of course, Andy, what I don't think you might have mentioned is that you're also the co-chair for our Community Outreach and Prevention Early Detection Committee. So that does obviously touch the work. One, you can bring in your wisdom from Colorado into AONN, and then vice versa. We can help support the state as well. So.
Right. Well, you know, Monica, I love nothing more than to talk about every committee I'm on. So it's funny that I missed that. So
I
know. But yeah, so I love it. Unfortunately, my slide with all the cancer groups, I'm not quite sure where it went, but I'm glad that I was like, wait, is that? So Christy and Lynn, I know that you or Emily, I'm sorry, I know that you guys are both on. Can I have one of you jump on and talk a little bit about our statewide navigation? And then while we're doing that, Sharon and Monica are with Academy of Oncology Nurse Navigation Plus, AONN Plus. So I think there were a couple of folks that might have missed that earlier, but they are definitely a huge part of what we're doing in our cancer work in Colorado, as well as what we're doing nationally, as you can tell. So thanks for that question. Emily or Christy, can you say a few words about the coalition work?
Sure, I'm here, but I want to let Emily speak if she wants to, because she's one of the co-chairs.
Yeah, so sorry. So really excited to get the navigation task force with the coalition up and running again. We're, looking for more membership. Obviously, we want to represent the entire navigation community throughout Colorado, and promotores de salud and community health workers as well. And again, just kind of getting up and running, and really looking forward to partnering with everybody to see how we can affect cancer care in Colorado.
Great. And I think AONN team has done a great job of connecting with the coalition. And I think we're really going to try to think a little bit about how some of the current initiatives underway and where the navigation component for the coalition can fit specifically for the cancer community. I think there's a couple of questions, and I want to go to Greta. With the current pressure on healthcare providers to find and keep staff, are there thoughts on leveraging navigators, community health workers to ease the shortage and make an argument for more consistent reimbursement mechanisms? So excellent question. And so here's kind of the double-edged sword of that. What's interesting is I think sometimes navigators and community health workers were the first ones, especially during COVID, sometimes who are almost considered to be or maybe let go or in the transition because there wasn't a solid reimbursability model. Yet they're very much the people who should have been involved in the community, contact tracing, and what have you. And so we're trying to make that case. But I think that's exactly it. Greta, is part of that is we're going to have to really talk about that value add. And I think back to Sharon's point, using those metrics and using really thought about that engagement side to show how that fits. That is a huge part of what we're going to be considering. So absolutely, yes. If you have other questions or thoughts about that, feel free to come off mute. And while we're doing that, I want to go to Lynn's question. Says, does your focus mean that as part of the current focus, you'll not be working on the para uncredentialed roles for community level workers? And so what I would say is right now, for those who are, lay navigators, I think sometimes that can be lay navigators, lay community health workers, but don't have necessarily a professional degree. I think that is going to be one of our main focus moving forward, is really thinking about how do we really codify their role. How do we really think, again, through our state health department, where we use a registry or accreditation type opportunity to really validate that role, but then we find reimbursability for that. So I think it's our real aim is to make sure that that group is really part of the system who's identified as a healthcare team and that there's a reimbursability there. So I think that will be part of our focus moving ahead. Some of those other legislative pieces that are coming right now, we're keeping an eye on where, CHWs and PNs might fit, but we're really trying to really validate that role for workforce development, for reimbursability, and just to be seen a really strong part of the healthcare team. Greta, did you have any other thoughts or questions? I want to make sure. And then Lynn, if you have any other thoughts, I'd have you come off mute as well. Are we good? I think we were right at the top of the hour. So, all right. So I wanted to see if there's any final comments, thoughts, or questions. David K., I see you right in my line of fire. So how are you, sir? Any thoughts or questions?
Well, I know we're out of time, but I've always wondered how sustainability is impacted by whether these interventions are finite in duration and then withdrawn to measure versus open-ended commitments. I know, especially in a lot of rural areas, there's open-ended commitments to the same group of patients that struggle. And I'm wondering if finite interventions, how that affects sustainability.
I don't, I think it's a really good question. I think one of the biggest issues that we have for finite, which are sometimes grant and research, is that we're not thinking about that next step. So I do think that, like for instance, something like CCSP that's quasi-finite, I mean, we will have an end because we're grant supported, but I think in that sort of setting, you get an opportunity to talk about making that case long-term. You're always going to have to advocate. Whereas I think that finite group, we have a finite amount of time to show that. But the question is what to do with it next. And I think so much of that just sits. And so I think you're right that half of that has to be buckled to the next thing and part of that is about sustainability planning is even if you do something for the finite, what does it mean for your next step and where you're going? And so I think, you bring up a good point is that if people are getting ready to do a pilot, it's not just about that, it's about where are you going? And that's got to be part of your sustainability plan moving forward. And so we talked about even with sustainability, communication and what does it mean for communication or accreditation? Like, it's not just about money. Sometimes it's really about making that case for. We have a lot of instances where CHWs and PNs have actually been hired and you have a change of the guard and all of a sudden you don't have the same leadership commitment. And so even though they were part of something that had a stronger reimbursability, so maybe their per member per month money was going to support them, you have new leadership who doesn't see that value or that's not communicated, they can be here today and gone tomorrow. So I think what you're talking about, David, is key. It's like thinking about sustainability from the beginning and what do you want to do with the information, metrics, measure, where are you going, and making that case is going to be huge.
Thanks.
So, oh my gosh, and we have somebody from Alaska. I'm not really sure how all people, it's fun to see. It'd be fun to see when an announcement goes out, how it hits all of the different areas, but I think I really appreciate the comment as well. And then Casey, more places should have thought about our ability to work from home instead of being let go. Yep. The community health work I work knows how important the PNs are. I'm very lucky. And we have a paper coming on right now about what the workforce looks like moving ahead. And so Greta's earlier comment about making that case, these are the first people who should have probably been maintained and ramped up, and really thought about even repositioning for COVID response. But in a lot of places, we just saw navigators furloughed or even completely let go. So what I just want to say again, there's going to be a lot of opportunity, no matter if you're in that engagement level, patient to patient, if you're a manager, you're thinking about this, if you're a policy wonk and you want to get involved, or if you're just really interested in where you and your org can fit moving ahead, Colorado is the place to be. If you're from another state and we can collaborate, we'd love to do that as well. We'll make sure and send along that resource opportunity. And for our CPED and CCRP team, we'll be continuing to work through that grant mechanism and other opportunities to really support navigation moving forward. But I think we need everyone around the table if we're really going to make that the true sustainability and recognize the great work and you're getting reimbursed for the good work you're doing. So 4 minutes over, have a great day. Thanks everybody, but we still have 40 people on. So this is amazing. Have a great day. Thanks so much for coming.
Thanks, Andy. Take
Thanks,
care.
bye.